What is Ebglyss? Ebglyss Lebrikizumab is a biologic treatment for moderate to severe atopic dermatitis to help relieve itch and clear skin. Ebglyss is used for atopic dermatitis moderate to severe that is not well controlled using prescription topical medicines in patients 12 years and older. Ebglyss targets the cause of atopic eczema inflammation to help improve dry, itchy, and irritated skin. In atopic eczema, a protein called IL-13 interleukin 13 is involved in the inflammation that causes atopic dermatitis. Ebglyss works by blocking IL-13, which reduces inflammation and improves atopic dermatitis symptoms. It is from a class of medicines called an interleukin 13 antagonist. Ebglyss is given as an injection under the skin, subcutaneous injection every 2 weeks until week 16 or later, and then as a single monthly injection for maintenance dosing. Who can use Ebglyss? Egblyss FDA approval is for moderate to severe atopic dermatitis eczema that is not well controlled using topical prescription therapies. It can be used in adults and children 12 years and older who weigh at least 88 pounds 40 kilograms. Ebglyss became an FDA-approved medicine on September 13, 2024. How well does Ebglyss work? In the clinical trials for atopic dermatitis Advocate 1 and 2, Ebglyss cleared or almost cleared skin in 38% of patients at week 16, compared to 12% using a placebo. At 16 weeks, 43% of Ebglyss patients felt itch relieved, compared to 12% who used a placebo. How long does it take Ebglyss to work? Ebglyss started working as early as 4 weeks when 10% of treatment patients' dermatitis had cleared or almost cleared. And by week 16, 38% of patients had cleared or almost cleared compared to 12% using a placebo. Ebglyss started working for itch as early as 2 weeks for 5% of patients. And by 16 weeks, 43% of patients had itch relief compared to 12% of patients on a placebo. Ebglyss side effects. Common Ebglyss side effects. The most common Ebglyss side effects are injection site pain or reactions, shingles, herpes zoster, and eye and eyelid inflammation, including redness, swelling, and itching conjunctivitis. These side effects occurred in 1% or more patients using this medicine. Serious Ebglyss side effects. Serious Ebglyss side effects may include allergic reactions that may sometimes be severe. Stop using this medicine and tell your healthcare provider. Or get emergency help right away if you get any of the following signs or symptoms: breathing problems, or wheezing, itching, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, skin rash, hives, cramps in your stomach area, abdomen, eye problems. Tell your healthcare provider if you have any new or worsening eye problems, including eye pain or changes in vision, such as blurred vision. This is not a complete list of side effects, and others may occur. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Warnings: do not use this medicine if you are allergic to the active ingredient Lebrikizumab LBKZ, or to any of the inactive ingredients in this medicine. See below for a complete list of ingredients. This medicine may cause hypersensitivity reactions, including swelling, angioedema, and hives, urticaria. Stop using this medicine if you have a serious hypersensitivity reaction. This medicine can cause pink eye, conjunctivitis, and inflammation of the cornea, keratitis. Report new onset or worsening eye symptoms to a healthcare provider. Parasitic helminth infections. Before starting this medicine, treat patients with pre-existing worm helminth infections. If patients become infected while receiving this medicine and do not respond to anti-helminth treatment, stop treatment with Ebglyss until the infection resolves. Avoid the use of live vaccines during treatment with this medicine. Before using this medicine. Tell your healthcare provider about all your medical conditions, including if you have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with this medicine. Pregnancy. Tell your healthcare professional if you are pregnant, plan to become pregnant, or become pregnant, as it is not known if Egblyss will harm your unborn baby. If you become pregnant during treatment with this medicine, you or your healthcare provider can call Eli Lilly and Company at 1-800-LILLY-RX 1-800-545-5979 to report the pregnancy. Breastfeeding. Tell your healthcare professional if you are breastfeeding or plan to breastfeed. It is not known if this medicine passes into your breast milk. How should I take Egblyss? Egblyss instructions. Egblyss is given as an injection under the skin, subcutaneous administration, using a pre-filled pen or pre-filled syringe with a needle shield. Before injection, remove the pen or pre-filled syringe from the refrigerator and leave at room temperature for 45 minutes without removing the needle cap. Do not warm by using a heat source such as hot water, microwave, or direct sunlight. Protect from light until use. Do not shake. Injections may be given into the abdomen, thigh, and back of the upper arm. It may also be given in the back of the upper arm by a caregiver or healthcare provider. Alternate the injection site with each injection. Do not inject within 2 inches 5 centimeters of the navel, or into areas where the skin is tender, bruised, red, hard, or in an area of skin that is affected by atopic dermatitis or skin lesions. Egblyss is intended for use under the guidance of a healthcare professional. Patients and caregivers should be properly trained in the subcutaneous injection technique to be used. Adult patients may self-inject, or caregivers may inject after training in subcutaneous injection technique. For pediatric patients, caregivers may give injections after training in subcutaneous injection technique. Injections should be inspected visually for particulate matter and discoloration before administration, whenever the solution and container permit. Egblyss is clear to opalescent, colorless to slightly yellow to slightly brown solution. Do not use if the liquid contains visible particles, is discolored, or cloudy. Refer to the instructions for use for complete administration instructions with illustrations provided with the medicine. Before starting this medicine, complete all age-appropriate vaccinations according to current immunization guidelines. Egblyss can be used with or without topical corticosteroids (TCS). Topical calcineurin inhibitors (TCI) may be used, but reserved for sensitive areas only, such as the face, neck, intertriginous, and genital areas. Egblyss dosing information. The recommended Egblyss dosage is 500 mg to 250 mg injections at week 0 and week 2, followed by 250 mg 1 injection every 2 weeks until week 16, or later when adequate clinical response is achieved. The maintenance Egblyss dose is 250 mg every 4 weeks. Egblyss is available as 250 mg 2 ml in a single dose pre-filled pen, 250 mg 2 ml in a single dose pre-filled syringe with needle shield.